I'd say the most frustrating part for me about having bipolar, because it is different for everybody, has been the medication dance. It took years of trial and error to get to a point where I was even somewhat stable. You're trying all these different meds, and you really have to trust your psychiatrist, and you really have to trust in the process. You know, halfway through it, it's very hard to do that because you're not feeling better, but you're taking all these pills and you're paying all these co-pays, and it feels like it's never gonna end.
Hello everyone. For today's topic, we will be discussing TMS for bipolar disorder. Let's get into it. Patients with bipolar disorder tend to be depressed for extended periods of time, possibly for weeks, possibly for months, with periods of mania or hypomania in between. One of the biggest things that we try to do for these folks is stabilize their mood. Classic stabilizing medications include, but are not limited to, Depakote, lithium, Seroquel, Trileptal is another one. Overall, these medications are very good at preventing manic symptoms. Mood stabilizers are not always great options for depressive symptoms, although for some people they do work. It is a risk using antidepressants with these patients because, believe it or not, an antidepressant puts them at risk for manic episodes. That's on top of the usual side effects that can happen with antidepressants.
That eventually led into a very deep depressive state and a lot of thoughts that eventually landed me in the psychiatric hospital. The doctor prescribed me an antidepressant that is obviously meant to cure depression, but in cases of bipolar, it actually raises the manic symptoms. It's actually a very common thing to have a misdiagnosis before getting diagnosed with bipolar disorder. My mood went from 0 to like 1,000, and without proper medications, I was spiraling out of control.
And with that being said, this brings me to the topic for today's video, TMS protocols for bipolar disorder. Now, the first things first, there is no FDA approval for this treatment. It will be totally off-label. Patients will need to have a conversation with their provider before deciding if this is right for them. As someone that has treated patients with bipolar disorder, I can tell you these patients tend to respond very well to treatment. Faster than people with unipolar depression is something that I've noticed. The good thing is the protocols stay the same. Repetitive TMS and accelerated protocols can be effective for both. The risk of doing TMS, like with antidepressants, is also similar. It has the potential to induce a manic episode. So over the next few minutes, I want to talk about some of the things that you might want to consider having in place if you are interested in doing TMS for bipolar. The number one thing that I think you should consider is not being afraid to end treatment early. Just because you have 36 treatments approved by insurance, or you plan to do a certain amount of treatments before you start, doesn't mean you need to do all of them. For instance, some people might be in remission by session 20 to 25. Remember, I mentioned that bipolar patients might respond faster than unipolar depressed patients. If that's the case, don't push it. Abort the mission. You've already won. I don't think we have an official recommended amount of sessions before mania happens, so you will need to play that by ear with your provider, and the provider will need to stay in constant contact with the patient.
Quitting while you're ahead is not the same as quitting.
Number 2, for accelerated protocols, the same rules apply. Just because the protocol calls for 50 treatments doesn't mean you need to do all 50. You can stop at day 2 or day 3 if sleep is notably decreased or if you feel yourself getting noticeably more irritable. I am aware that some providers have you pay up front. If that's the case, consider having a negotiation with them for special circumstances. Both provider and patient need the ability to walk away from the treatment without consequences. Also, keep in mind with accelerated treatments, it may be more difficult to stop because of the rapid pace that the treatment is going. With standard treatments, you're going at a much slower daily pace. It's a lot easier to hit the brakes if you need to. So the next thing, number 3, social support. As a provider, I would have a very difficult time doing TMS for bipolar with no support from a loved one or another provider. You need to have someone else that can see things from a different perspective. Family, friends, romantic partners. They'll all notice changes faster than providers do because they know you best. If there are no loved ones available, a therapist might be a good option as well. And the next thing, number 4, emergency medication. I have recommended to previous patients that we have at least one prescription of an abortive mood stabilizer available at home. The reason for that is if you notice you're not sleeping, thoughts are racing, you're beginning to feel more irritable or paranoid, one of the best things at those times is to get some sleep. Sleep in bipolar disorder is one of the most important things to help someone reset and stabilize their mood. My usual go-to is Seroquel 50 milligrams, but you can also use Zyprexa, Risperdal, and yes, lithium and Depakote are traditional mood stabilizers, but I don't think they are as effective for the situation that we're discussing. That is something that should be discussed between doctor and patient. Every doctor is going to have their own preference. I should also say if you have a diagnosis of bipolar disorder, it would be a good idea for you to already be on a mood stabilizer for a few weeks or a few months prior to starting treatment. Next, number 5 is the safety plan. Should things go really awry, discussing where you would go if hospitalization is necessary is important. Obviously, 911 is an option in a pinch, and you can also check yourself into a facility or an ER that's close by. And lastly, number 6, I wouldn't recommend starting unless you have a good understanding of what your symptoms were the last time you were manic or hypomanic. It's important to have some idea how you were feeling at that time so that you know the signs and symptoms should they return again. Just in case I didn't mention this before, you should also not be in a current manic or hypomanic state while starting or doing TMS. If you make some of these considerations, there's the potential for TMS for bipolar to be a great option for patients that otherwise didn't have many tolerable options to improve their depressive symptoms before. Thank you for your time. I hope this video was helpful. Feel free to ask questions or comment below. I'll try to get back to you as soon as I can. Take care.